On the heels of an unprecedented ruling in the state of Nebraska, tonight critics say it's time for a change in the prison system. Yesterday, a judge ordered doctors from the Lincoln Regional Center to treat Nikko Jenkins, but at a separate facility. Senior reporter Jake Wazakowski investigates new at 6. Jake?
Jen, the regional center told Judge Peter Battalion it refused to take Jenkins because it could not make sure the staff, patients, and the public would be safe. Some state leaders say they're watching the prison system closer than ever. The Lincoln Regional Center has always been expected to take inmates who have mental health issues, but they refused to take four-time killer Nikko Jenkins. In Judge Peter Battalion's ruling Tuesday, he said the LRC has serious security issues that need to be addressed. Medical Director Roger Donovic outlined how their seclusion cells aren't secluded, the staff is unarmed, and security is inadequate.
And we still are following it because we think there are still some things to learn.
Nebraska Ombudsman Marshall Lux, who takes complaints against state government, says the revelation is concerning because the state needs to improve the mental health system for the growing prison population.
Well, the expectation always has been that was what that facility was for, among other things. And it's a surprise, I'm sure, to a number of people.
Jenkins will go to either the Lincoln Correctional Center or Diagnostic and Evaluation Center, both run by the prison system, while his competency is restored for the death penalty phase of his trial. The LRC will run it, but officials don't have a final plan to handle Jenkins yet. Senator Ernie Chambers is worried the prison will dictate what happens to Jenkins, possibly putting him in solitary, which would not improve his competency.
Every time the prison decides it wants to do something, it'll do it, and what they say as a prison will trump what the regional center staff will say from the standpoint of medical care and treatment.
Chambers says we now see how the mental health system between the regional center and prison system is broken. Lux says he's only heard good reports about the LCC, but admits changes are in store.
And so it's important for us, I think, for policymakers as well, to know what that facility can and can't do, because some important decisions have to be made soon.
Lux says a bill is being discussed in the unicameral that could help. He says it would create a mental health facility for correctional inmates at the Hastings Regional Center, which is currently used to rehabilitate youth. Reporting live in the News Center, Jake Wazakowski, KMTV Action 3 News.